There is one seed sitting in spice cabinets across America right now that modern research has confirmed actually helps repair damaged nerve fibers. Not just reduce inflammation, but support the regeneration of nerve tissue itself. Tonight, I am telling you exactly what this seed is, exactly how to prepare it correctly, and exactly what the research shows it does for chronic sciatica. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Drop a comment below, your age and your city. Now let us get straight into this. The seed is fenugreek, small, golden brown, slightly bitter, available at most grocery stores in the spice or international foods aisle, and widely available on Amazon for just a few dollars a bag. It has been studied for its anti-inflammatory and nerve protective properties for decades, and what is different tonight is that I am not asking you to take my word for it. I am showing you what modern laboratory research has actually found. Here's exactly how to prepare it the correct way, by boiling, not simply soaking. Take 1 tablespoon of whole fenugreek seeds. Add them to 2 cups of water in a small saucepan. Bring the water to a gentle boil, then reduce to a low simmer for 10 minutes. The seeds will release a golden tint into the water and begin to soften. After 10 minutes, remove from heat and let it sit covered for 5 additional minutes. Strain the liquid into a cup, discarding the seeds or saving them to add to food separately. Drink this warm, ideally in the morning on an empty stomach. Boiling matters specifically because fenugreek's beneficial compounds, including its mucilage fiber and its saponins, are more fully released into water through heat than through simple overnight soaking alone. The 10-minute simmer is long enough to extract these compounds without degrading the more heat-sensitive elements, which is why 10 minutes specifically, not 20 or 30, is the target. If the taste is too bitter for your preference, a small amount of honey or a slice of fresh ginger added during the simmer makes it considerably more pleasant without affecting the active compounds. Now here is what the research actually shows this seed does and why it is genuinely different from most other natural remedies discussed for sciatica. Most natural anti-inflammatory ingredients work by reducing swelling and calming irritation around an already damaged nerve. Fenugreek does that too. But laboratory research published in peer-reviewed journals has gone further, specifically studying what fenugreek seed extract does to damaged sciatic nerve tissue itself, not just the inflammation surrounding it. In one study, researchers working with nerve injury models found that fenugreek seed extract improved the function of damaged peripheral nerve fibers and supported measurable nerve fiber restoration. In a separate study specifically using sciatic nerve defect models, fenugreek seed extract was shown to support nerve regeneration when combined with standard nerve graft repair techniques, with researchers noting improved nerve cell activity and reduced inflammatory markers at the site of nerve damage. Additional research has found that fenugreek seed powder protected sciatic nerve structure from damage in studies involving nerve-related conditions, with measurable preservation of normal nerve tissue architecture compared to untreated groups. This is a meaningfully different category of benefit than simple anti-inflammatory action. Reducing inflammation calms an irritated nerve. Supporting nerve fiber regeneration addresses the deeper, slower process of the nerve actually repairing itself at the cellular level, something most commonly discussed remedies for sciatica are not specifically studied for. The mechanism behind this comes down to several compounds concentrated in fenugreek seeds. Flavonoids and alkaloids in the seed have demonstrated antioxidant effects that protect nerve cells from the ongoing oxidative stress that chronic inflammation produces. Saponins in the seed have shown anti-inflammatory activity that works on some of the same inflammatory pathways targeted by conventional anti-inflammatory approaches. And specific compounds in the extract have been linked in laboratory research to supporting the activity of Schwann cells, the specialized cells responsible for maintaining and repairing the protective myelin sheath around nerve fibers, including the sciatic nerve. When the myelin sheath around the sciatic nerve is healthy, nerve signals transmit normally and pain sensitivity remains at an appropriate baseline. When chronic compression and inflammation damage this sheath over months or years, the nerve becomes increasingly sensitive, often firing pain signals disproportionate to the actual physical irritation present. Supporting the cells responsible for maintaining this protective sheath is a meaningfully different target than simply reducing swelling. There is a second mechanism worth understanding because it explains why consistency matters so much with this particular remedy. Fenugreek seeds are extremely high in soluble fiber, specifically a type called galactomannan. When this fiber is released through boiling and consumed regularly, it has been shown in research to help stabilize blood sugar levels after meals. This matters for sciatica more than most people realize. Chronically elevated blood sugar contributes to a process called glycation, where excess sugar molecules bind to proteins throughout the body, including nerve tissue, accelerating nerve damage and inflammation over time. By helping moderate blood sugar spikes, fenugreek indirectly reduces one of the contributing factors that keeps nerve tissue in an inflamed, easily irritated state. It is important to be clear about what this research does and does not show. Much of this research has been conducted in laboratory and animal models rather than large-scale human clinical trials specifically for sciatica. This does not mean it does not apply to humans. These are legitimate, peer-reviewed studies published in established scientific journals, but it does mean fenugreek should be understood as a research-supported remedy with a genuinely interesting mechanism, not a guaranteed cure with the same level of human clinical evidence as a prescribed medication. For most people without specific health complications, fenugreek tea is considered safe for regular use. However, there are several things worth knowing before adding it daily. Fenugreek can lower blood sugar, so anyone taking diabetes medication should monitor their blood sugar closely and discuss this with their doctor before adding it daily, as the combined effect could drop blood sugar lower than expected. Fenugreek has mild blood-thinning properties, so anyone on blood-thinning medication should check with their physician first. It is also not recommended during pregnancy due to its traditional association with inducing labor. For daily use, 1 cup of this boiled fenugreek tea in the morning is a reasonable starting point. Some people prefer a 2nd cup in the early evening. Consistency matters more than quantity. The nerve-supporting compounds work cumulatively over weeks, not instantly. Most people researching this report needing at least 3 to 4 weeks of consistent daily use before noticing a meaningful shift in their symptoms, which aligns with the slower, cellular-level nature of the nerve support mechanisms involved, as opposed to the faster relief some people feel from purely anti-inflammatory approaches. Here is a simple way to track whether it is working for you. Each morning before you get out of bed, rate your sciatica pain on a scale of 1 to 10. Write it down. Do this for 1 week before starting the fenugreek tea, so you have a true baseline. Then continue tracking daily once you begin. Most people who respond to this protocol notice the first small shift around the end of week 2, often described not as the pain disappearing, but as the burning, sharp quality of the pain becoming duller and less reactive to movement. By week 4, compare your daily average to your original baseline week. This gives you an honest, personal way to evaluate whether it is making a real difference for you specifically rather than relying on how you feel on any single good or bad day. One additional practical note: the leftover boiled seeds are not waste. Once softened, they can be added to a salad, mixed into rice, or eaten directly with a small amount of honey, giving you the fiber and remaining nutrient content from the seed itself in addition to the tea. A few storage and sourcing tips: buy whole fenugreek seeds rather than pre-ground powder when possible. Whole seeds retain their active compounds significantly longer than powder, which begins losing potency once ground due to increased exposure to air and light. Store the seeds in a sealed container in a cool, dark cabinet where they will stay potent for up to a year. If you only have access to ground fenugreek, the same boiling method works. Simply reduce the simmer time to about 5 minutes since the compounds release more quickly from powder. And strain through a fine mesh or cheesecloth since powder will not settle as cleanly as whole seeds. This is general educational information based on published research. It is not a guarantee of results for any individual, and it is not a substitute for medical care. If your sciatica is severe, worsening, or accompanied by weakness, numbness, or loss of bladder or bowel control, seek medical attention immediately rather than relying on any home remedy. Drop a comment and let me know if you try this. Subscribe for more research-based natural approaches every week. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease or medical condition. Fenugreek may lower blood sugar and has mild blood-thinning properties. Consult your healthcare provider before regular use if you take diabetes medication, blood thinners, or are pregnant. Individual results vary. If you experience sudden severe pain, weakness, numbness, or loss of bladder or bowel control, seek emergency medical care immediately. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Viewer discretion advised.